What is the social situation? GPs look after the health of people in their local community and deal with a whole range of health problems. They also provide health education, offer advice on smoking and diet, run clinics, give vaccinations, and carry out simple surgical procedures. GPs usually work in practices as part of a team, which includes nurses and non-medical staff, such as receptionists and practice managers. GP surgeries also work closely with other healthcare professionals, such as health visitors, midwives, mental health and social care services. What can you expect? You would normally meet GPs or other healthcare professionals at their surgery. If your GP cannot deal with a problem, then you'll usually be referred to a hospital for tests, treatment, or to see a consultant with specialist knowledge. Unspoken rules. Your GP surgery cares for a large number of people. The professionals offer their services to people with a range of needs, meaning it's unrealistic to expect them to know all about autism. Their specialism is health, and they make their decisions based on the information the patient gives them and their knowledge around health. Your surgery is there to serve the people of the community. When you enter the GP surgery, you are a visitor and will be expected to follow the rules set out for their place. One unspoken rule is to speak in a courteous way, which shows respect for the health professional, including using pleasantries such as please and thank you. At times, demands on the surgery can be high, and any behaviour that might seem demanding is seen as breaking this courtesy rule. If you've asked for an urgent appointment, you probably won't be able to see your named GP or other professional. You'll be seen by the next professional available. Each surgery has set up a system to care for their patients in the most effective way. Generally, the system works, but like all systems, there are times that it might not. Patients can make suggestions, and the most effective way to do this is in a calm way using the complaints procedures. You can ask for a copy of these procedures in the reception. Challenges for autistic adults.
One of the problems with attending GP surgeries is that there's a lot of background noise and a lot of distractions and a lot of things going on in the background, which can be quite challenging and quite distressing for an autistic person, particularly when they're wanting to communicate on a one-to-one basis across a counter with the reception staff. And also, there's a lot of stress in the background that other people are going through, which can also be projected onto the autistic person. In terms of timing, that can be particularly challenging for an autistic adult. Because one, they can go along at an appointed time expecting to be seen at that time. And in fact, GP practices and doctors can be delayed for a number of reasons. And appointments can be delayed anything up to about an hour at times. And the poor autistic person can become more and more stressed because they're waiting, and they're waiting in that stressful environment. And then when they go in to see the GP, they've then got the problem that it may only be a 10-minute appointment time that they've got. And there isn't sufficient time to be able to explain to the GP what the issue is and what the problem is, particularly when they're having to try and discuss things across in a neurotypical way. One of the problems that autistic people have when they're actually in the consultation with either with a nurse or doctor is that they can often not focus on what the doctor needs to know and what the doctor needs to hear, and they can often bring in other problems, and they're discussing those which are not relevant to the issue or condition which they're there for. Autistic people can often struggle with how are you, how are you feeling, how are you today? They may be standard questions that, everyday questions that normal neurotypical people may have, but autistic people can struggle with very basic questions, everyday questions. The problem is that autistic people don't understand what is inferred by the question. They may understand the words, but when they put the words together, it may mean something completely different in their mind.
What can professionals do? Please allow the person to have a named doctor or nurse if possible, allowing a double appointment if necessary should the patient experience difficulties expressing their needs. Explain who to speak to should the named person not be available. Ask specific questions. For example, this question is about your physical health, or I am asking about your mood. If possible, identify a quiet waiting area for the person to wait should they have sensory sensitivities. Or allow the person to wait outside if they prefer to, once they let you know they have arrived. You can send a text or call them when it's their turn. Be prepared to repeat and explain your decision to ensure it makes sense to the person. Give handouts about key information that meets the 2016 Accessible Information Standards. What can the autistic adult do?
One of the things that you as an autistic person can do when you go to reception is you can ask the receptionist if they're expecting a delay. Often they may say that there's a slight delay, or they may give you something a bit more specific in terms of time. It may be 10 minutes, but don't necessarily expect it to be 10 minutes. It could be 10, 15, 20 minutes, because 10 minutes in a neurotypical mind is completely different from someone like yourself who is much more precise. One of the coping strategies that you can deal with an expected delay is that there is no harm in bringing along a book or something that you enjoy reading, so as that distracts you from the other pressures that are going on around you. One of the strategic tactics that you can do to speed up the process of an interview is you can tell the healthcare professional that you have Asperger's or you're autistic, and that will quickly enable that healthcare person to switch to making reasonable adjustments on your behalf. And it will also speed up the interview process because they're not having to work out what's going on there. And they can concentrate on the problem in hand. The other thing that's worth mentioning here is that if you tell a healthcare professional that you've got Asperger's or autism in a consultation, private consultation, that is confidential, and they can't discuss that outside to third parties. When you make an appointment to see a healthcare profession, one thing that's worth doing is it's worth noting why you're going to see the healthcare profession, what your problems are, what your symptoms are, so that when you're discussing this with the healthcare profession, you've already got that written down. It will speed up the process and the interview considerably, and help both you and the healthcare profession, and you also get the points that you want made over at that time. Your GP practice, your doctor and your nurses are there to help you, and for both healthcare issues and mental health issues. They're not there to help you with general everyday issues. So it's okay to go and see them if you've got issues that concern your health or your mental health. For everyday issues, you need to either join a support group, local support group, which specifically deal with your concerns, or you, if there are more pressing concerns, you need to contact the Samaritans.